let me introduce our speakers. Ashley McNary is an experienced product director supporting our Star Intelligence solution, as well as clinical data acquisition services. Her primary responsibility is the successful delivery of our solutions, ensuring they address the most pressing challenges for HEDIS, Star Ratings, and retrieval initiatives. Driven by her passion to see improvements in healthcare quality, Ashley takes pride in working with clients to improve their Star Ratings and HEDIS initiatives, enabling better care for their members. She has been with Cotiviti for more than 10 years. And Marge Ciancetta is the product manager of Cotiviti's Star Intelligence tool, which assists health plans and providers to improve their quality ratings and Star scores. Marge ensures that Star Intelligence represents the voice of Cotiviti's customers and aligns with industry best practices. She works closely with our development team, as well as with customers and stakeholders, to ensure that their feedback is incorporated into the product roadmap. With over a decade of experience in the quality space, Marge has a unique perspective on the challenges and opportunities facing health plans and providers today. And now, I'll turn it over to Ashley to kick things off. Ashley?
All right, great. Thanks, Cassie. Hi, everyone. Good morning, good afternoon. The Centers for Medicare and Medicaid Services proposed more changes to Star Ratings in the 2024 Medicare Advantage and Part D Advance Notice than ever before. Health plans need to react to these changes to stay ahead of the curve. It's no longer okay to just monitor where your Star Ratings are today, but necessary to shift to a prospective approach to optimize plan performance. In our webinar today, we will be discussing how utilizing technology can help your team better understand the impacts of the market changes. Implementing a proactive approach can help you detect early gaps and opportunities. And lastly, how tracking Star measures is best done through a collaborative team approach. We have three main agenda topics today for our webinar. So first, I'm going to look at some challenges that plans face today with their Star Ratings program. Marge is then going to discuss the possible impact of the changes on your program. Plus, we'll have a demo of the Star Intelligence solution. And then after that, I'm going to talk through some elements of a successful STARS program. All right, so let's jump right in. So I'm actually going to start with a poll question, as I really want to hear from all of you first. I'm really curious to learn from you, which challenge do you think is the biggest threat to Medicare Advantage plans today? Is it standing out in the market, with the number of plans out there, kind of that competition aspect? Is it reaching higher Star ratings, just with all the different changes kind of going on and how, what measures you need to focus on? Or third, is it tracking those annual changes and impacts? So like I said, so many changes have been proposed and are going through all of the official rulemaking here. Is it just understanding, where are we with the different changes, and then understanding really how those changes are going to impact you? So I would love it if you could give me your opinion. So which of these three do you think is kind of your biggest problem, or just the biggest problem you're seeing within Medicare Advantage today? All right, so it looks like we're about at 30% of responses. So I'm going to give you all just a little bit more time here. Let's see if I can get to 50% of attendees to give me your opinion. Okay, we are getting there. All right, so I'm going to go ahead and close the poll. Oh, a few more. Okay. Ooh. Okay, so I will go ahead and let's look at those results. Okay, so yeah, reaching higher Star ratings at 54%. And then tracking those annual changes and then standing on your market. So interestingly enough, we actually did the same survey during our client conference a month ago, and it was evenly split between reaching higher Star ratings and tracking annual changes. So interesting to see the reaching higher Star ratings kind of get that boost here with all of you. So I'd actually like to now take a minute and just kind of break down these challenges and kind of provide a little bit of context around them. So first, let's dig into the competition piece. I have a couple graphs I want to share with you. So the first one here from Kaiser Foundation, it is showing you the enrolled Medicare Advantage lives over the last 10 years. And you can see we've had quite a bit of a jump up to just under that 30 million lives enrolled in Medicare Advantage. And interestingly, so CMS has actually released data just recently saying that the number of members in traditional Medicare is right around 33 million. So we're actually almost at half of all eligible Medicare members choosing Medicare Advantage over traditional. Now, as we have more and more people enrolling in Medicare Advantage, well, we know that we need more plans to support these members. So that's the second graph here. So this is actually looking over the last 7 calendar years, the total number of plans that have been introduced into Medicare Advantage. So right now there's just around 1,000 different plans out there for members to research and dig through to really find the best fit for them. So as the number of plans grow within your area, potentially it is becoming harder for you to really stand out, from the competition. To really make sure that you're growing the way that your plan wants to be growing. So going into the second challenge now, which a lot of you agreed with here. So star ratings, it's a big math problem, right? So as these new plans are coming into the market, it is kind of harder to really get to those higher star ratings. As a lot of you know, plans are basically rated on this bell curve, right? And so as there's more plans that are coming in, it's, getting harder and harder to be at that, end of that bell curve. So this graph here shows the distribution of star ratings from 2018 until 2023. Majority of plans here are in that 4 and 3.5 star buckets. 3.5, 4 star buckets, whereas less there are in the 4.5 and the 5 star range. Now, the orange in this one here does represent those 2022 star ratings, which we do know were inflated because of those COVID policies. But what I find interesting about this graph is really looking at that decline in all the star ratings in 2023, except for the 3-star where we saw that big jump. Now, a lot of that is because of those new plans who were now publicly rated for the first time. So because of COVID policies, some of those plans were delayed a year. But also it's because of that decline as 4.5, 5-star decrease, those plans, had to go somewhere. The other important factor I want to kind of throw out here is according to the CMS enrollment data in the latest star ratings in 2023, about 70% of all eligible members were in a 4-star or higher contract. So that means the majority of members who are choosing Medicare Advantage are in a smaller number of plans. So if your plan isn't in this range, you most likely are missing out on that important membership growth with only maybe minimal members enrolling during that open enrollment time. So with that increased number of plans and the fact that it's harder to get to those higher star ratings, really how do you stand out, among your peers? All right, so let's talk about the third challenge a little bit. And this is really around the compliance changes. So this table shows you both the confirmed and proposed changes. And one thing I'll note is that this whole graph is available, I think, in the resource box here on the On24 panel, but it's also available on our website. So I don't need you actually reading what all of this is, but really the main point here is just the sheer number of changes being confirmed and proposed to the program over the next few years. So it is really hard to track and understand the impact when there are so many changes. I know I get lost all the time. Just this morning, I had to reopen up this calendar to remind myself some of the changes that are happening. But I imagine for a lot of you out there, it's so easy to lose focus when you don't have clear priorities on what to focus on. Plus, I'm sure a lot of you are dealing with just competing priorities because stars might not be your only responsibility. So with a lot of the challenge, I think with all of these challenges that I'm talking through, I think that a more mature Medicare Advantage plan, one that's maybe been out there for 5 or more years, may not be so worried about what's going on because you might have some strong processes in place, you might have some strong team members, so you'll know that you'll be able to get to your star ratings. But as I'm sure a lot of you might be newer to the market, I feel that a lot of you might need help to just navigate these challenges. Make sure you understand, where you need to maintain, where you need to improve your star ratings to make sure you can continue to compete in this market. So with that, I'm actually going to turn it over to Marge, who's going to break down a couple of these changes that we're seeing and really share with you that impact.
Thanks, Ashley. Again, my name is Marge. With so many changes, it's getting harder and harder for plans to know what to focus on. So in this section of our presentation, I'll cover the things that your plan can do to help find the right things to focus on that will have the biggest impact on your star ratings. So I'll cover 3 things. First, I'll cover 3 changes to the CMS Stars program that I think will have the biggest effect on plans. Next, I'll show you a quick high-level demo of the Star Intelligence tool to get you familiar with its functionality and benefits. That will lead to our third topic, where I'll show you how to use Star Intelligence to measure the impact of program changes at your plan and identify the best areas for you to focus on. So let's start with the 3 changes to the CMS program that I think will have the biggest effect on plans. Change number 1 is here on the screen, measure weight changes and addition. So this chart shows the weighted measure contribution of each measure category toward the overall star rating contract. A 3-weighted measure like med adherence contributes 3 times as much as a 1-weighted breast cancer screening measure towards that total contract value. Each color on the graph represents a different star rating year, spanning from 2023 through 2026. So what we see is a tremendous shift in the measure category contributions over these 4 years. Let's delve into the details to understand the reasons for these shifts. First, there are a lot of proposed measure additions. We've already seen FMC, TRC, PCR added back in the last few years. Now, CMS is proposing the addition of COA functional status assessment, KED, and 3 Part D measures in 2026. So this accounts for the increase in weight in the HEDIS and pharmacy categories. Second, there are some big changes to the measure weights. CBP was added back in at a 1 weight, increased to a 3 weight the following year. Same with PCR, added back in at a 1 weight, increased to a 3 weight the following year. The biggest change, though, is that the 16 patient experience and access measures, which roughly equates to the CAHPS measure category, are proposed to decrease from a 4x to a 2x weight in 2026. Accordingly, you'll see that CAHPS category nearly cut in half by 2026. That is a huge shift. We're expecting 18% of plans to lose half a star due to that change alone. So what does this mean for plans? CMS is signaling a back to basics approach to measurement. There will be less focus on the qualitative survey measures and more focus on the quantitative HEDIS and pharmacy measures. Many plans have invested a lot of time and resources into those qualitative measures over the past several years, only to see their weight cut in half. It can be a little disheartening. In response, we need to shift our focus so we're prepared for these changes. The second change that I think will have the biggest impact on plans is the proposed changes to the hold harmless provision. In 2018, CMS announced that plans that scored a 4 stars or more before the improvement measure was applied would be held harmless. In other words, once plans hit a 4-star, they wouldn't be dinged if their rates didn't continue to improve. CMS's reasoning was that with higher star ratings, that led to less room for improvement, making it harder for plans to achieve significant improvement. Now, CMS is changing their tune. They said, actually, there's still room for improvement at 4 and 4.5 stars. Starting in 2026, only 5-star plans will be held harmless. So what does that mean for plans? It's getting harder to achieve and then maintain those star ratings. Plans will need to continue to focus on significant improvement even after they've reached 4 stars. From this change alone, we expect 15% of plans are going to lose half a star. Medicare estimates a 10-year savings of $19.3 billion from this change alone. The third and final change to the Star Ratings program that I want to review is changes to the cut point methodology. CMS has made a number of changes to the cut point methodology over the last several years, with the first one being mean resampling in 2022 to reduce the sensitivity of the clustering algorithm to outliers. The goal of that change was to reduce the random variation that contributes to fluctuations when determining cut points. The next change was the Tukey outlier deletion in 2024, which removed extreme outliers before the clustering algorithm is applied. So the goal of this change was to provide additional predictability and stability around cut points by removing plans that scored extremely high and extremely low compared to the rest of the industry before setting those cut points. And then finally, one more change is proposed in 2026, and that's the removal of the guardrails from the non-caps measures in 2026. This change would allow cut points to shift by more than 5% so that they can accurately reflect unanticipated large changes in industry performance. So for example, during COVID, we saw a huge decline in preventative screenings. With those guardrails in place, cut points wouldn't be able to fall by more than 5% in order to accurately reflect the industry's decline in compliance. So this change leads plans to receive lower scores when cut points are artificially inflated due to the cut points, hence their removal. Together, these 3 changes to the cut point methodologies can have a huge impact on your cut points. This slide shows an example of the blood sugar A1C control measure for 2023. So that blue or purple color there shows the published CMS cut points, whereas the pink shows the simulated cut points after those changes were incorporated. So as you can see, the 3-star cut point increased by 10, and the 4-star cut point increased by 5. The lesson for plans is to make sure that you are tracking towards your predicted cut points that incorporate these changes in methodology. Otherwise, you can really be falling short of your expected star ratings. So let's take a step back and think about what these changes mean as a whole. What do they mean for you? What should your plan be focusing on to prepare for the changes?
Marge and I have really identified 4 key elements to what we feel are critical to have a successful STARS program. So they are embracing a STARS solution, creating a team approach, engaging your network, and being proactive. All 4 of these elements allow your team to be both strategic and collaborative to help you meet your goals. So one of the more basic tools you can use for tracking your star ratings is the STAR solution. Using a solution can ensure there's a single source of truth for all stakeholders to review and agree upon when it comes to your star ratings. Plus, a solution, especially one that's integrated with your HEDIS vendor, can reduce the manual time it takes to count results, get the data in a format that's workable, or reduce the time it takes you really to enter the data from your HEDIS solution into a separate spreadsheet or maybe a Tableau instance. So if using a spreadsheet is your option today, which I'm sure many of you are doing that or have done it, I think you probably can relate to the fact that there are many times these data entry errors that might come up. Maybe you entered in that rate just a little bit incorrectly, or maybe you have conflicting measure results, right? So you see something for a measure, this team has over here versus what this team has over there. Or maybe one of the biggest problems you have is that you spend more time working the data to get it into the format you need it to get into, rather than following up with the team to make a difference in your star ratings. So a solution can certainly help with, all of those challenges. Now, if you are a smaller STARS team, using a solution can help you feel confident in the ratings and be able to sit in front of those providers or your C-suite with reliable, easy to read data that demonstrates the impact of an increase, a decrease, or even staying the same in your STARS performance. In addition, a STAR solution can help you benchmark your performance against competitors. So I know earlier I said that this was a big challenge. Not a lot of you agreed maybe standing out in the crowd is your number one focus, but it is really important to understand kind of where other plans are in your market, where they rate it. This can really help you not just stand out in the crowd, but understand the right measures that you need to focus on so that you can improve your performance and then, make sure you're kind of standing out against the other plans. But it's not always, like a 5-star as to where you need to be. In some markets, the highest star rating might only be a 3-star in a specific measure. So understanding where your competitors are can, again, help you create those targets and help you create that focus. So, of course, being a higher star in a certain measure can be an advantage to maybe newly eligible members who are searching for a Medicare Advantage plan or, people who are looking to make a change. Since, like I said earlier, we've seen it in the data that members are choosing the higher rated plans when looking to enroll. Lastly, solutions can support other trending options like your year-over-year performance, to ensure each measure is trending in the right direction, or help you review measure results across all your contracts to make sure you're focusing on the right measures. Now, of course, Excel spreadsheets can do this too, but I just know, how much time it takes to keep those updated and refreshed. It can just be a real burden kind of on your resources. So using that STAR solution, it's a great way to just help you focus, right, on the right measures at the right time. So our second element is creating that team approach, which it sounds like a lot of you are doing today. So obtaining higher star ratings, it requires us to be collaborative. It's not a single person who can do this. Like Marge said earlier today, maybe using that scenario modeler, you've identified what measures you want to focus on. Well, make sure that you're assigning measure owners to those measures. So you really know who's responsible for the improvement in that measure and can ensure correct resource allocation for those measures. Now, maybe this person isn't a dedicated resource, and that's okay. Just make sure that tracking these measures are part of their annual goals. And then you'll want to make sure you create those check-in meetings, right, with the whole team, or maybe you just have like part team in some meetings and whole team in other meetings. But the important thing when you do these check-in meetings is the right cadence that works for your team and your organization. Daily meetings might be overkill for some of the plans out there, but it might be the right cadence for others. Whereas maybe a monthly meeting is just too far apart to hold the owners accountable. You may spot issues at one of these review meetings, but if you're meeting too infrequent, you might be too late to adjust the plan and reroute to the right path. Now, at these check-in meetings, make sure you have the right people present. So these are people who help make decisions or approve budgets. If a new action plan comes up and you need some funding to start some campaign, they're there in the room, they hear the importance, they can help hopefully push those approvals along. Now, having members from the finance team attend these meetings can be really helpful, as they can provide those accurate dollars and how much is at stake if you lose a star rating or if you gain a star rating. In my experience, people tend to listen when real money is being talked about. Doesn't matter what the topic, right? Lastly, what do you do when measures are trending lower than expected? Well, if it's a focus measure, hopefully it has come up in these review meetings so teams can pivot quickly to a revised plan or implement that new campaign to close those gaps. But what if it's a measure no one was tracking? Well, first, I really recommend you understand the impact of that measure. So a single weighted measure that may miss a star rating goal is not going to have a big impact on your overall score. Your breast cancer screening, it goes from 4-star to a 3-star, just, single weighted measure, again, not a big impact. But what if it's a triple weighted measure and you're losing, an entire star in those medication adherence measures? That's going to be a little bit more urgent. So you need to make sure you work together as a team, create that action plan, and determine the best path to ensure that rate doesn't decrease anymore, or how to get back on the path to, maintain or increase. You really need the whole team to be working together. The only way this works is when everyone's on the same page, working towards the same goal. Now, the third element here is engaging your network, which I was a little surprised. A lot of you didn't say that this is part of your strategy today. But again, I guess I'm not really that surprised because a lot of people don't engage their network, maybe as much as you should, right? Because providers really should be seen as partners in this whole star ratings game, right? So a couple things to think about when engaging your network. So one of the big things is just understanding your use of scorecards and how you should be using them consistently. So we recommend using scorecards that can highlight areas of gaps and improvement opportunities. Make sure that they give your providers the relevant information and actionable insights, and really tells them kind of what they need to do. And then if you are going to use scorecards, make sure you're using them consistently. So are you sending them, monthly, weekly, quarterly? What's the right cadence for that specific group? Another big area with scorecards is also just understanding your provider's motivation when you're sharing them and talking through the data. So for example, is money a big motivator? Well, if so, provide incentives to your network in closing their gaps. Make sure your scorecards show them how much money they're leaving on the table if they don't hit their goals. And then make sure that you give them, again, those actionable insights, those targets that they need to work towards, like how many gaps do they need to close to get to that star rating. Now, alternatively, is ego a big motivator? Show them how they stack up against their peers. Include rates and how this group compares to their competition down the street. I wouldn't underestimate the power of competition and the need to be best in town. Or maybe it's both, in which case then you're creating a packet for these groups that really gives them the best of both worlds. One of the other things I think to think about too when you're reviewing these scorecards with your providers also is just understanding, what you want to talk to these groups about in these meetings. Talking about everything is probably going to overwhelm them. They don't have time for this. Maybe think about one or two items to focus on at each meeting. Another area I would think about at these meetings is even doing light training about star ratings and why they're important. Maybe annually you talk to your provider teams about the importance of the CAHPS measures or these surveys, and what type of questions that the members are getting in these surveys and why it's so important, with how the providers engage with your members, right? We know those CAHPS surveys are mostly how providers engage with members. So having, making sure the providers understand kind of those questions and that importance is probably a really smart strategy to have with your network. Lastly, you don't need 100% of providers to be engaged to reach that 5-star level. So it may work better for you to focus your resources on the groups that will engage. However, if you do need to engage groups that might not want to engage, we definitely recommend maybe going back to basics. Go back to these plans, understand, what is their motivation, what's the best way to get them engaged. Okay, my last element is to be proactive. So we really weaved this concept throughout the webinar today, but we do want to make sure that you are tracking at least 2 years in parallel. So right now, that's definitely closing up your 2024 star ratings, which was based on that MY 2022. But already you should have at least a couple months done in 2023 to be understanding that impact for your 2025 star ratings. Now, some plans that we've talked with, they go out a third year and they're tracking 2026, but without any data, it's really all guesswork at this point. So we really recommend just keeping it to the 2 years that you have, insight into and you can build plans around. Like Marge said earlier, if you're not using predicted cut points, you're really kind of hurting yourself, because we know that those cut points are drastically going to change over the next couple of years. So you really need to be using those predicted cut points to better highlight those gaps and opportunities. Track display measures, especially the ones being proposed. Now, the HEDIS ones should be easy to track. Those should be in your HEDIS tool already. But talk with your vendor to see if they can help you calculate those Part D measures. So there are 3 Part D measures on the display page that are proposed to being brought in. Now, I know here at Cotiviti, those proposed Part D measures are already part of our state and custom measure library. So if you are using us, talk with your team today on how you can turn those on so you can start reviewing the rates and understand what those member gaps are. Lastly, monitor, right? So make sure you have a tracking tool in place today that can give you those real-time insights as to how your performance is trending. All right, so with that, I'm going to turn it back over to Marge.
Thanks, Ashley. I'm going to take a moment to wrap up today's webinar with a brief recap of what we covered. So CMS is proposing more changes than ever before, right? The 2024 MAPD advance notice had so many proposed changes, and it's really difficult to figure out what to focus on. Health plans need to respond to these changes and stay ahead of the curve in order to stand out amongst their peers. It's insufficient to monitor where your star ratings are today. You really need to be looking ahead, and so that prospective approach is needed to optimize your plan's performance. We reviewed your roadmap to reaching and maintaining higher stars with Star Intelligence. So that predictive solution seamlessly integrates with our quality intelligence platform and empowers plans to prioritize the actions needed to offer better care to their Medicare Advantage population and optimize their bonus payments. So, in summary, we discuss how to utilize technology to help your team understand the impacts of market changes, implement a proactive approach to detect early gaps and opportunities, and lastly, track star measures using a collaborative team approach.
This will conclude today's webinar. Thank you to our speakers, Ashley and Marge. Thank you for joining us, and we look forward to seeing you again soon.